The muscle of the week is the sternocleidomastoid, or the SCM. From its name, sterno comes from the sternum, cleido from the clavicle, and mastoid literally from the mastoid. As its name suggests, the SCM originates from the manubrium of the sternum and the superior surface of the clavicle, and inserts on the mastoid process and the superior neutral line. The SCM contributes to the flexion and rotation of the neck. When both sides of the muscle work simultaneously, they flex the neck and bend the head. When only one side works, it rotates the head to the opposite side and laterally flexes it to the same side. You can stretch the SCM by relaxing the muscle in the opposite direction of the contraction movement as shown. To strengthen this muscle and make your neck thicker, you can perform neck curls and lateral neck curls. If the SCM is abnormally tight or shortened on one side, it could lead to a condition called torticollis, causing the head to tilt to one side. This can be congenital or develop from muscle strain. The muscle of the week are the scalenes. The anterior scalene originates from the C3 to C6 transverse processes and inserts on the upper surface of the first rib. The middle scalene originates from the C3 to C7 TPs and also inserts on the upper surface of the first rib. Both muscles elevate the first rib and bend the neck towards the same side as the acting muscle. The posterior scalene originates from the C5 to C7 TPs and inserts on the outer surface of the second rib. It elevates the second rib and tilts the neck to the same side. As they lift the ribs, the scalenes act as accessory muscles of respiration along with the SCM. To stretch the scalenes, start by sitting up straight while sitting on your hand. You can stretch the middle scalene by gently pulling your head away from the hand you're sitting on. To stretch the posterior scalene, pull your head forward and down towards your armpit. For the anterior scalene, place your hand behind your back, turn your head away from that side and tilt it back slightly. The anterior and middle scalenes can be involved in certain forms of thoracic outlet syndrome, where tension in these muscles compresses nearby nerves, leading to numbness and pain in the hands and arms. TOS can be assessed using the elevated arm stretch test or Adson's test. The muscle of the week is the splenius. The name Splenius comes from the Greek splenion, meaning bandage, and the Latin caput, meaning head. This reflects how the splenius wraps around the back of the neck like a bandage. Splenius capitis arises from the lower half of the neutral ligament and C7 to T3 spinous processes and inserts on the mastoid processes and the occipital bone. Splenius cervicis arises from the T3 to T6 spinous processes and inserts onto the C1 to C3 transverse processes. Together, they are prime movers for head extension. They also assist in lateral flexion and rotation of the cervical spine to the same size as the active muscle. The SCM and the scalenes are antagonists to the splenius. If you have a throbbing pain at the back of the head, you may want to stretch the splenius. Sit with your torso resting on your thighs and use 2 fingers to bring your chin between your collarbones as shown. The splenius muscles are common size for myofascial trigger points that can cause pain at the base of the skull, behind the eye, or at the top of the head. Poor posture, stress, and prolonged screen use are common triggers for splenius-related dysfunction. The muscle of the week are the suboccipitals. They consist of the rectus capitis posterior major, rectus capitis posterior minor, obliquus capitis superior, and obliquus capitis inferior. RCP major originates from the C2 spinous process and inserts on the inferior neutral line. It contributes to head extension and ipsilateral rotation. RCP minor originates from the C1 posterior tubercle and inserts on the medial part of the inferior neutral line. It acts as a weak extensor of the head and works synergistically with the RCP major and the OCS. OCS originates from the lateral mass of atlas and inserts on the lateral half of the inferior neutral line. It assists in head extension and ipsilateral flexion. OCI originates from the C2 spinous process and inserts on the lateral mass of atlas. It contributes to the ipsilateral rotation with the RCP major. Collectively, the suboccipital muscles play a key role in proprioception, providing the brain with precise information about head and neck position to aid in spatial awareness and movement coordination. To stretch these muscles, start by fully retracting your cervical spine and tucking your chin down. Then gently press the back of your head upward towards the ceiling. Incorporate a slight lateral bend, and once you feel the maximum stretch, hold it for 20 to 30 seconds. The muscle of the week are the deep cervical flexors. They consist of the longus capitis, longus colli, rectus capitis anterior, and rectus capitis lateralis. Longus capitis originates from the C3 to C6 transverse processes and inserts onto the basilar part of the occipital bone. It serves as a strong flexor of the head and also assists with ipsilateral flexion. Longus colli has its origin on the C5 to T3 transverse processes and inserts on the anterior arch of the atlas. It aids in cervical spine flexion and provides deep stabilization to the neck. Rectus capitis anterior arises from the lateral mass of the atlas and attaches to the basic occiput. It contributes specifically to flexion at the atlanto-occipital joint. Rectus capitis lateralis originates from the upper surface of the C1 transverse process and inserts onto the undersurface of the jugular process. Its primary function is to assist in lateral flexion at the atlanto-occipital joint. Try chin tucks to strengthen these muscles. Lie on your back, gently tuck your chin, and press your head into the floor. Hold it for 10 to 15 seconds. When ready, lift your head slightly and hold it for 20 to 30 seconds. The longus colli is especially vulnerable in rear and whiplash injuries, which involve a rapid hyperextension hyperflexion motion of the neck, often due to car accidents. Some scientists suggest it may contribute to a loss of the natural cervical curve in affected individuals.